we go. Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. Sorry to be running just a few minutes late here, but here we are. And for those of you that have been here before, you know this is a webinar that we create each week with your questions. And for those of you that are new, I'm glad to see many new names here and faces on my message board tonight. The way you participate is to write your questions to me in the chat box that is located on the right-hand side of your screen. I believe it shows up on the right-hand side of your screen. The thing I ask is when you write those questions, try to be brief. If they get too long, I'm not able to post them for everybody to read. And then also it locks up my computer screen, believe it or not. So if I happen to see that it's a very long question, I probably just won't answer it, okay? I am creating a recording of tonight's webinar, and you'll get, I should have an email out to you tomorrow morning if things go as planned this evening. I actually have to edit the video and write us a brief synopsis of it and have that all ready to go tonight. I'm actually not going to be able to post it tomorrow morning, so I'm going to try to get it all done tonight and get it ready to go tomorrow morning. All right. So as everything goes as planned, you'll have it tomorrow morning. If not, I probably won't be able to get to it until Saturday, the way that tomorrow is looking at this point. So hopefully that comes together tonight, as I hope it will. Tonight's webinar, I'm going to do for actually as an hour webinar, not an hour and a half. I have another obligation I have to get to later tonight and only have time to do an hour. This is our last webinar for this month. I will be off next month. I do 3 weeks of webinars, and then the 4th week I take free from my webinar, so I won't be doing a webinar next week. When you get the email tomorrow, you can sign up for the next series of webinars. I'll have that all prepared and ready to go as well, okay? So look for that in the email, and again, in the email, it'll tell you how to click and watch the recordings of tonight's webinar too, okay? So without any further ado, let's go ahead and get started here. We'll get through as many questions as we can, okay? Hello, Nathan. Let's see. I'm currently treating my Lyme with doxycycline, clarithromycin, and grapefruit seed extract. Recently, I found out I had a peptic ulcer. The treatment I would be taking for that is amoxicillin, clarithromycin, and a PPI. Would it harm my treatment plan to replace the doxy with amoxicillin to treat the ulcer for 10 days and then are returned to the original plan? So in my opinion, it probably will not hurt your treatment to do that. So, but let's talk about that real quickly. So the clarithromycin and the doxycycline in terms of part of a Lyme treatment plan could be doing a couple things, all right? Number one, those two medicines work to treat a form of the Lyme germ called a spirochete. So that's when you look online, you see pictures of Lyme, the spirochete's the corkscrew looking thing, okay? Lyme also lives in another form in you, which is a microscopic cyst form, and neither one of those antibiotics touches that, okay? Both of those antibiotics also treat Lyme where it lives in 2 different places. So Lyme can live inside of cells and outside of cells. These work both in and outside of cells, okay? All right. The amoxicillin, oh, one more thing. So clarithromycin is part of a family called the macrolides. Doxycycline is part of a family called the tetracyclines. The way that both of them work is they get inside of a germ or inside of a cell, and they limit the germ's ability to produce proteins. So the germ has a hard time growing. And they both limit the protein production in 2 different places in that production pipeline, basically. So they have added effects of blocking protein production. All right. Now, that's how it would work for the Lyme germ. Now, if you happen, we also can use that combination to treat another infection called Bartonella. And Bartonella is a bacteria that can be transmitted by ticks that often can give people a lot of neuropsych symptoms, sometimes bad thinking, sometimes pain on the bottom of the feet, for instance, sometimes tremors, okay? Bartonella is best treated when you use 2 antibiotics that get inside of cells. And as I said, these are both intracellular antibiotics, all right? Okay, so I'm not sure what you're treating, whether it's Lyme or Bartonella, all right? Okay, now, the amoxicillin that you would be using to substitute the doxycycline works in an entirely different way. Amoxicillin is known as an extracellular antibiotic. It does not get inside of the germ, nor does it get inside of cells. And the way that it works is it prevents the germ covering from repairing itself when it gets injured. So indirectly, it results in holes being punched inside your germ. So as the germ grows, it bursts. It can't be held together, okay? So amoxicillin, if you're using doxycycline and clarithromycin to treat Bartonella, amoxicillin is not a good substitute. But the clarithromycin will at least hold your Bartonella at bay for a little bit by itself, okay? Regarding Lyme, amoxicillin is going to be at least working on the spirochete on the outside of the cell. The clarithromycin will be working on it on the inside, okay? So the only way that this may not be a direct equivalent, if you will, or quite as effective is if you're treating Bartonella for 10 days, you're going to have a slightly weaker treatment. I do think the clarithromycin will still keep the Bartonella from replicating. And the reason that that's important is that Bartonella replicates every 24 hours. So you don't want to be off of a Bartonella treatment entirely until you're done treating the Bartonella. Okay? All right. So I hope that answers your question okay there. Yeah. Anyhow, those would be my thoughts, my comments on that. Okay. All right. So let me go ahead and get rid of that question. And good luck to you, Nathan. Hello, JT. Let's see. Hi, Doc. I've had cherry angiomas pop up on my body as well as areas under my skin that looks like the small vessels have slightly leaked. Is this common in BART? Secondly, do you ever see any cardiac involvement or nerve damage with Bartonella? Lastly, is the low VEGF associated at all with Lyme, Babesia, or Bartonella in your experience? Okay, so first of all, those little cherry marks that you're seeing on your skin can often be associated with Babesia, actually, or they can be just a part of the aging process. If you're getting a lot of them, they sound like they could be associated with Babesia. Occasionally, they can be associated with Bartonella too, but we tend to associate them more with Babesia. To see if you have Babesia, consider if you have other Babesia symptoms, all right? So Babesia symptoms can be air hunger, which is a feeling you can't get enough air. Babesia symptoms can be drenching night sweats, can sometimes be panic attacks, and sometimes can be heart rate variability. So your heart will race and then slow down. Sometimes you get lightheaded when you stand up. Those are, and then headaches in the front of the head are things that make us think of Babesia, okay? The way that Bartonella can sometimes lead to those is Bartonella infects the cells that line your blood vessels. It's one of the things that infects. And it can result sometimes in the breakages in the blood vessels as well too. But I tend to see more of what you're describing as something more consistent with Babesia. Okay. All right. Let's see. And is this, secondly, do you ever see cardiac involvement or nerve damage with BART? So nerve injury is common in Bartonella. So that, yes, I would answer that. In terms of Bartonella, the only cardiac issues that I tend to see that I have seen in my practice is I have some patients that have inflammation of the lining of the heart or the outside covering of the heart called the pericardium, or when it gets inflamed, we call that pericarditis. I have seen that occur with Bartonella before. And then in terms of VEGF, VEGF, everyone, is a chemical that's made by the cells that line your blood vessels. And it can be elevated in certain conditions, but I have not seen it be low with the condition with Lyme, Babesia, or BART before. Okay, if it's elevated, it sometimes can be something that actually supports a Bartonella diagnosis. All right, thanks for that question, JT. Hello, Remy. Let's see. If we are feeling much better after months of Lyme growing form treatment like cat's claw and otobobark, is it still a good idea to treat for persisters? In other words, do you see less relapses with people treated for Lyme persisters? Good question. So let me kind of put everyone on the same page here, or talk about this so I can make sure everyone's on the same page. So in the world of Lyme disease, we've been trying to figure out why is it that some people don't get well, and also why is it that some people relapse, okay? So in the last 4 years, there's been some research coming out of various labs in the country showing that Lyme has the ability to have two growth states. There's a rapidly growing form of the germ, and then there's a form of the germ where the germ slows down its metabolism and effectively goes into hibernation. In hibernation, it ignores the traditional antibiotics, okay? So those hibernators are also known as persisters. Now, what to do about persisters is new. It's a brand new area. We about 2.5 years ago, we discovered in lab experiments, or it was discovered in lab experiments in Stanford, for instance, that disulfiram could treat those persisters. And out of a lab out of Johns Hopkins University out in Maryland, there's also a lot of research going on right now by a lab run by a physician named Ying Zhang. And Zhang's lab is showing other things that can treat persisters. For instance, oregano oil, for instance, methylene blue has been shown in laboratory experiments, okay? Now, the problem with all these experiments, they're lab experiments. And what happens in a laboratory may not happen in a human. Now, when it comes to these persisters, one of the treatments that has gotten the most attention is the disulfiram. And as many of you know, a lot of people have been using disulfiram these days. And that seems to be giving, my practice says maybe about 30% of people are getting significant benefit from that. But it's not the universal treatment that's going to help everyone, for instance, okay? All right, so the question is what you're raising here, which is, should as part of our treatments, should we be putting everybody on antibiotics that treat growing forms and persister forms? And the answer is, I don't know for sure. I'm starting with a group of my patients to put some of those on persisters. And the reason we don't know for sure is we don't know for sure, do persisters block the treatment in everyone? We know we can create them in the lab, but we don't know whether that is a situation that actually happens in living humans, or does it happen in everyone all the time? So there are a lot of people I've gotten into Lyme remission and actually been able, I think, to cure their Lyme by never doing anything about persisters, okay? More and more, though, what I'm starting to design into my treatments is adding something that can deal with persisters. And one of the things, for instance, that I've been adding is oregano oil as a 75 milligram pill. I've been talking about it incorrectly. It's not 150 milligram, but a 75 milligram pill of liposomal oregano oil is what I've been adding to my Bartonella treatments to treat Bartonella persisters. And I've been adding it to some of my Lyme germ treatments as well, too. You could look at even, having used your Cascalanotoba, you could look at going on a 4-month to 6-month of disulfiram, or you might see about being on methylene blue. The answer is it could be helpful, but we don't know for sure. All right. And yes, in a lot of my treatments now, there are some patients that I actually am putting them on things for persisters as part of the treatment, where I have them on either prescription antibiotics to treat the growing forms, or I have them on herbal antibiotics to treat growing forms. And then I'm putting them either on disulfiram, methylene blue, or oregano oil to treat persisters in terms of the Lyme germ. In terms of Bartonella persisters, which is another area we're now starting to understand Bartonella can have persisters, at least in the lab, it looks like, based on Petri dish experiments, disulfiram probably is not a good agent, at least in lab experiments, for persister Bartonella. But oregano oil and methylene blue appear that they are. Now, in clinical experience, we're still trying to decide, does it make a difference to put people on oregano oil? And does it make a difference to put people on methylene blue? What I can tell you in my experience over this last year of working with both of those, I am not seeing the huge Herx reactions that I get when I put somebody on disulfiram, for instance, okay? So I think I'm still trying to learn how to work with these, and I know a lot of my colleagues are as well, too, okay? All right, thanks for that question, Remy. Hello, Laura. Let's see. Is my inability to break down sulfur due to a CBS gene preventing me from reaching a therapeutic dose of disulfiram? I get extreme pain, fatigue before I can reach 250 milligrams. I weigh 120 pounds. Is this why I also get sicker when I increase my dose of sulfatrim? How can I break down sulfur and ammonia? So the answer is maybe it is. It's hard to say. I don't know. There's a lot we don't understand about what happens with disulfiram as to why people sometimes cannot get up to a higher dose on it or not. It may have something to do with your ability to detox the sulfur. It may have nothing to do with it. So for instance, I have people that I can get only to half my estimated dose that I want to on the disulfiram, and they don't have CBS mutations, okay? So it's possible. Do I have other ideas on how to detox that sulfur or break it down? No, I don't, because genetically you have impaired pathways in terms of dealing with it, and I don't have alternative ideas for you on that, okay? What I will say is there are some patients in my practice that I'm not able to get to the target dose. And everyone, when I say a target dose, basically we decide what is the disulfiram dose that we're trying to work you up to based on how much you weigh, all right? And so there are some people that I'm not able to get all the way to the top dose, but I get them to half a dose. And I see that they get benefits from that, okay? Keep in mind these doses we came up with, there's no science that tells us what is the best dose. These are estimates that we came up with based on body weight and based on working with the medicine, but we don't have science that tells us what's the best way to treat. So in some ways, some of the doses that we have are arbitrary. Even in the articles I write, those doses that I came up with are an arbitrary estimate based on the experience of Dr. Ken Liegner in working with the medicine in his practice. He's the first physician that started working with this. And most of us have tried to follow his recommended dosage scheme. But the truth is, we don't have any science that tells us what truly is the best dose per body weight. We don't have that. All right. So it could be some people do better with lower doses. All right. Good luck to you, Laura. Hello, Tim. Hi, Dr. Marty. Could you tell me a bit more about using herbal powders instead of using tinctures? I have to avoid alcohol due to being on disulfiram, so I decided to get herbal powders. I'm currently using Hutania powder, Sida acuta leaf powder, cornea leaf powder, and Cryptolepis root powder based on what I read on your website. Thank you so much. So to be honest with you, I don't work with powders. And so I'm not a good person in terms of figuring out what's the best way to dose them or to use them. So I work with tinctures. And so I'm not, I don't know. What you might want to look at in terms of dosing recommendations on those, a person that could have written about them would be Buhner, as in Buhner Herbs. Buhner is a master herbalist. And on some of his recommendations, I know he talks about powders, he talks about grams. I tend to just work with tinctures, and so I don't have a good idea on how much powder to tell you to use. Okay, sorry about that. Good luck to you, Tim. Hello, Doug. Let's see. Hi, Dr. Ross. Thank you for hosting another very helpful webinar. You're welcome. Could you please explain the interaction roles of treatment and the immune system in killing off Lyme, Babesia, and Bartonella? Specifically, how much does the immune system, i.e. antibodies, need to contribute versus treatment? If the disease has compromised the patient's immune system, can treatment alone get the job done? How do you build the immune system back to help? And finally, if the immune system gets distracted with something like SIBO or another problem, does that make it more difficult to treat Lyme, Babesia, and Bartonella? Okay. It's good. You're asking the $1 million question. And the reality is there's a lot of unknowns here. Okay. In other words, the research does not exist to answer specifically the question you talk about. All right. What I can tell you is based on just bacteria in general, not specifically about Lyme, Babesia, and Bartonella. But what we know about infections in general is to get rid of them, you need a combination of germ killers, things that can kill the germ, like antibiotics, or in the case of viruses, antivirals. And then you need the immune system to come in and help clean up and also get rid of the germs. In other words, you need to do things together. In theory, it is possible to use just your shotguns, if you will, of antivirus and antibiotic, but people do better if you have both the immune system as well as the germ killers working together, okay? In terms of Lyme immune suppression, keep in mind, so the major forms that we get into with immune suppression in Lyme, one of the big things is when you have Lyme in you, your immune system, and trying to get rid of it, manufactures a group of chemicals called cytokines. Cytokines are good and bad. On the good side, they actually are intended to turn the immune system on. So when your white blood cells start producing cytokines, they cause more white blood cells to be made. They trigger white blood cells to go to where the infection is, and they help them work better. That's all good. But there's also science that says if you have too many cytokines, that you actually get suppression of the immune system. So you don't have, not only do you just not get the signals that tell more white blood cells to be made, or do you get the signals that draw them to the infection, you just actually get some suppression of the immune system across the board, okay? So that's one thing that can happen. And then regarding your question about SIBO, any other infection that triggers cytokine excess can broadly suppress the immune system. So it is true if you've got SIBO, or it's true that if you have mold toxicity triggering more cytokines to be made, or if you developed mast cell activation syndrome, where your mast cells, where histamines are made, are actually overly turned on, they become cytokine producing factories. That can suppress your immune system broadly as well too, okay? So when I'm treating somebody for Lyme, one of the best things that I try to do to get the immune system working better is to get rid of things that might be suppressing the immune system. And that might mean that the best we can do is to use antifungals to get rid of yeast that are triggering cytokines, or we might use antibiotics to kill Lyme that are triggering cytokines, and hope that as we bring the germ load down, that the cytokines become lower, that the immune system turns on in a better way to be able to help us, okay? That's kind of the theory that I'm using germ killers under, is not that the germ killers ultimately are going to get everything done, but that we can lower the germ load enough that the cytokine levels drop, that the immune system eventually kicks in to start helping us, okay? So it's important as part of your treatment is to identify what's triggering your cytokines. Could be Lyme, could be Bartonella, could be Babesia, might be too many yeast living in your intestines. It could be SIBO. It could be mold toxins that are built up in you and trapped in you, okay? You got to figure out what's triggering your cytokines, try to start dealing with those so eventually you can lower the cytokines, all right? Second thing is that helps lower cytokines and helps your immune system work better is sleep. Get 7 to 9 hours a night. And if you have to wind up using things to help get sleep, like drugs or herbs, use those. 7 to 9 hours of sleep at night helps restore the immune system. Third thing I like to do to boost the immune system is to have people on agents that lower cytokines. And so I'd like to have people, for instance, on curcumin, liposomal curcumin, 500 milligrams 3 times a day. The reason I work with liposomal curcumin is curcumin is actually, which is a derivative of turmeric, it gets inside white blood cells and interrupts cytokine production. It's not that well absorbed on its own. All right. So you want to make sure that you're, in terms of working with it, you want to have a liposomal variety that actually increases the absorption. Okay. Other things that I build into my treatment protocol, I like working with an adaptogen, which is also acts as an adrenal and thyroid support, called ashwagandha. Ashwagandha also helps boost your immune system, okay? And then the other thing I like to do is make sure that people are in good micronutrients, good multivitamin, to give your white blood cells what they need to thrive, to work correctly, okay? So basically, if you look at my Ross Lyme support protocol, The steps that I build into that are designed to get your cytokines lowered, to get your immune system working better, okay? So I'll show that to you here in a second so you can see what I mean by that, all right? So let me just do a quick screen share here. All right. So let's see. So this is my Lyme disease information site, Treat Lyme by Marty Ross MD. Take a look at my treatment protocol. All right. And again, a large part of this is designed just to get your immune system working right. So get sleep. I identify prescriptions and herbs you can use here. Number two, be on a healthy diet. I talk about I like working with a plant-based, heavily plant-based paleo type diet. I like lowering cytokines that I just mentioned, and there's some ways here I mentioned to do that. I like having people on ashwagandha as an adaptogen. I like supporting the hormonal systems. That helps your immune system work well. I like having people on a good multivitamin. There's some basic detox steps that I like to do as part of this, which is be on glutathione. And exercise, if you can boost the immune system. And then get your infections out, the primary ones that could be triggering cytokine excess. So get yeast out, and then treat your Lyme and treat your co-infections, okay? Those are all built into my protocol, all right? And a lot of that, again, is oriented at knocking the cytokines down so your immune system is going to work well. I admit, at first, when you start treating your germs, you're just going to be blasting away with your guns. But eventually, as you lower the cytokines down, hopefully the immune system turns on to help you get rid of these germs, okay? All right. Thanks for that question, Doug. Hello, Patsy. Hi, Dr. Ross. Thank you very much for hosting these webinars. You're welcome. So I have two questions. In the case of having Lyme and Bartonella, can you explain why you would treat Lyme before treating the Bartonella or other co-infections? Number two, dihydromycin is said to be helpful when taking disulfiram because it helps to break down acetaldehyde. Would dihydromycin also help with combating Herxheimer reaction? Thanks again. All right. So let me answer the first part of that question. So in my the way that I treat Lyme and co-infections is I always will treat Lyme and pick one co-infection initially to go after. I usually do not treat Lyme and two co-infections at the same time because it gets hard from a side effect standpoint and mixing the medicines together. All right. So for instance, if I've got somebody that's got Lyme, Bartonella, and Babesia, I'm probably going to start by treating Lyme and Bartonella first. I will not go in order. I will not treat Lyme, then treat Bartonella. No, I'm going to treat the two of them side by side, running down the same railroad track at the same time. Okay. Why do I pick treating Bartonella before Babesia? The reason is based on an observation of Burrascano. Burrascano, many of you may be familiar with, is a physician that taught a lot of us how to manage Lyme disease. He's one of the Lyme pioneers. And he had an observation in his practice that if he tried to did not get rid of Bartonella before treating Babesia, that it became very hard to get rid of Bartonella. All right. And that's my observation as well, too. So I've tended to follow that in my practice as well. Okay. In terms of the dihydromycin, I don't know if it would help with the Herxheimer reaction. Acetaldehyde is not something I find significant in a Herxheimer reaction, but I have never tried it for Herxing, but I doubt that it would make a difference there. Okay. All right. Thanks for the question, Patsy. Good luck to you. Hello, Laura. Let's see. Oh, that question was from my daughter who has Lyme. Got it. Thank you. Hello, Luke. Let's see. Hey, Dr. Ross. Vision, depth perception, focus issues, brain have issues processing information. Lyme or Bart or Babesia. So both Lyme and Bartonella can give you both neurologic and psychiatric issues. And so based just on what you've said here, vision, depth perception, focus, brain, that tends to be all neurologic. So it could be Lyme, or it could be Bartonella, or it could be a combination of both, just based on that, okay? Now, I would need to ask a lot more questions to find out, are there anything else that suggests Bartonella? Or is there anything else that suggests Lyme? But if just on those questions right there, I would say either one of them could, okay? I tend not to think of Babesia being involved neurologically like this. Thanks for the question, Luke. Hello, Cindy. Let's see, amongst all the other tick-borne diseases, it is the mycoplasma pneumoniae that is challenging me the most currently. At the moment, I am beginning to experience erythema multiforme major and wondered if you have any advice on how to deal with this skin and mucosal issue, especially before it can progress to Stevens-Johnson syndrome. Also, do you have any wisdom as to how to find a specialist with an extensive knowledge of this disease, particularly one Oregon insurance might cover? Boy. Cindy, I'm not going to be a good source for you on this one. First of all, I don't know a dermatologist down your way that would have some sense of this. I will also let you know it is not necessarily mycoplasma pneumonia that can give the erythema multiforme. Lyme can do it as well, too. And then actually the mycoplasma, mycoplasma is controversial. I know there's a group of doctors that treat Lyme that think that it is a major problem. I tend not to. The reason is if we were to pull 100 healthy people off the street and do blood testing, we would find elevated antibodies against either mycoplasma pneumoniae, chlamydia pneumoniae, the monovirus, human herpes virus type 6, or Epstein-Barr virus in about 10 to 20% of these people. In other words, 10 to 20% of healthy people have immune systems that have elevated antibodies that are elevated because we cohabitate with these germs. These are common germs that live even in healthy people, and our immune systems live with them the same way that we live with germs on our skin. Just finding antibodies against mycoplasma pneumoniae does not mean it is a problem. And I tend not to treat for it. I think the bigger problem is Lyme and co-infections, and I don't call mycoplasma co-infection. The bigger problem would be Lyme or Bartonella or Babesia. If you have continued erythema multiforme, I would keep working on the Lyme, and I would want to know if you have Bartonella based on your symptoms too. The other thing I will tell you, any of the intracellular agents that we use to treat Lyme or to treat Bartonella, intracellulars would be things like zithromax, clarithromycin, rifampin, rifabutin, the tetracyclines, doxycycline, and minocycline, Bactrim. Any of those intracellular antibiotics are also treating mycoplasma at the same time if it is a problem, okay? But I'm not a big believer actually in the whole mycoplasma pneumonia. I think it's a common background infection. I think the real problem is Lyme, especially if I see a problem like this, okay? All right. So my word of advice, keep treating your infection, but make sure you're treating the right infection, okay? All right. Thanks for the question. Good luck to you. Hello, Tracy. Let's see. Have I had a chance to investigate Vibrant American Vibrant Wellness tick-borne disease tests? The patient info on the website doesn't say a lot. Thanks. So, Tracy, I'm not using them, and I have not investigated because I'm actually quite happy with my current source for Lyme testing, which is IGenex. I tend to use IGenex. The reason I tend to stick with IGenex is they have a good track record of validating their test. In terms of Lyme disease testing at this time, The best test out there actually is their newer Lyme immunoblot, not their Western blot, but their immunoblot. Their immunoblot has the ability to find Lyme if it's there based on their validation studies 95% of the time. Their immunoblot actually looks to see, are you making antibodies against 8 kinds of Lyme germs? And in addition, they take the proteins from those Lyme germs, they genetically modify them to remove parts that might attract antibodies made against viruses. And by removing those parts, they make it so you don't get a false positive, okay? So that test will find it if you have it 95% of the time. And when it finds it, the chances of a false positive are about next to 0. There is not another company out there that is doing anything like it. The Vibrant is making a Western blot, but it's not going to compare to this immunoblot, okay? It is something I should do eventually, is ask them for their validation studies, but I haven't. And the reason is I'm happy with IGenex. I think it is accurate based on their validation studies across the board for the kind of testing that they do. Okay. All right. Thanks for the question. Hi, Judith. What is the best treatment for Bartonella? So, I published an article about that 2 or 3 weeks ago. I'll show you that article here in a minute. So basically, there's been quite a bit. There's been some new laboratory research coming out. Not human. We don't have good human research about Bartonella. But at the end of 2019 and then in April of this year, there were a couple pieces published by the lab at Johns Hopkins by Ying Zhang. Ying Zhang's lab is looking at ways to treat persister Lyme and persister Bartonella. And his lab showed a number of things. They did experiments looking at showing which antibiotics might be the most successful at treating growing Bartonella. And in addition, they identified that Bartonella can have persister forms and that Bartonella can form biofilms. And they also showed on those tests what things we might use for persisters and Bartonella. According to their research, the 2 types of antibiotics that might have the most activity, the best activity against Bartonella would be to use a rifamycin, which would either be rifampin or rifabutin, coupled with a macrolide. And the one they used was Zithromax, but it's possible clarithromycin would work as well. Those 2 antibiotics seem to be the most effective at growing forms of the germ. And what I find in clinical practice is that I find people do best if you put them on at least 2 intracellular antibiotics. And so generally these days, when I start a Bartonella treatment to go after growing forms of the germ, I am working with a combination of azithromycin or rifampin. All right. Now, if somebody can't tolerate those and they're not responding to them, then I'm going to look also at the tetracycline, like a doxycycline or minocycline. The Johns Hopkins experiment showed that doxycycline can still be effective, just a little bit less strong than a rifampin and a Zithromax. Okay. In addition, the Hopkins studies, I think, showed that the fluoroquinolones like Cipro can do all right, but I don't like using those because the fluoroquinolones like Cipro and like Levaquin can sometimes give you bad tendon inflammation problems and even tendon breakage, so I tend not to use those these days. The Hopkins studies did not look at Bactrim, which is a sulfa antibiotic. Other researchers have shown that Bactrim can have fair ability to treat as an intracellular antibiotic too, okay? So to treat growing forms these days, generally I'm starting with azithromycin or rifampin based on these laboratory experiments, these laboratory strength experiments, okay? All right. In terms of what I'm also doing then, at usually within the first month or 2 after I get somebody on those antibiotics, I'm going to add something to treat the persister forms of the germ. And that can be one of 2 things or both. The persister forms, I often will start with liposomal oregano. I like using liposomal because it means it's microscopically wrapped in fat to increase its absorption. The Ying Zhang Hopkins lab experiments show that Oregano is good at treating persister forms of Bartonella. Experiments done outside of Hopkins show that oregano is also useful at breaking down biofilms, okay? And so I will do a 75 milligram pill twice a day. I previously had written 150 milligrams, but I misunderstood the dosing on it. It's actually 75 milligrams of liposomal oregano. And if you look on my store site, you'll see that I have a product from Dr. Inspired Nutritionals that per pill is 75 milligrams. One pill twice a day seems to be helping people, okay? The other option would be to look at using a medicine that has to be compounded called methylene blue. And again, this was studied by Ying Zhang and his Hopkins lab. And the methylene blue in their experiments breaks up Bartonella biofilm and also treats Bartonella persisters quite well. And the dosage that I've been using on that is 50 milligrams twice a day. There is some caution you have to show with methylene blue in terms of if you are on antidepressant medicines or herbs that raise serotonin. Methylene blue also raises serotonin, and you can get into something called serotonergic syndrome or serotonin syndrome if you happen to use it with those. Okay, so I usually don't use it with those. The other thing about methylene blue is it's going to turn everything blue. So your urine, your saliva might start looking, your poop might start looking a little bit blue or blue-green tinged. Some people, the other thing you have to do with methylene blue is you need to make sure that you have enough of an antioxidant in your blood, or an antioxidant called G6PD. And so I usually have people get a G6PD test, because if you are low on G6PD, it could lead to rupture or breakage of your red blood cells, okay? Because the methylene blue is a little harder to use, I tend to start more with oregano first. One of the things that makes it harder to use is you have to get it from a compounding pharmacy, and it can run for like a 60 pills supply. It's going to run about $180, $190. Okay, and insurance probably won't pay for that. All right. So let me show you, do a screen share so you can take a look at my Bartonella article, and you can look at the research that I've supplied there too. All right. So again, this is back at my information website. This is Treat Lyme by Marty Ross MD. In terms of Bartonella, take a look at my infection treatment plans and look at my article called Kills Bartonella, a Brief Guide. And I walk you through the idea about growing Bartonella, persister Bartonella, and the Bartonella biofilms. And I talk about what to do about it here. Okay? All right. Thanks for the question, Judith. Good luck to you. Hello, Brenda. Hello, Dr. Ross. Thank you for these webinars. Do you think a person with Lyme disease and co-infections is more susceptible to coronavirus? It's a good question, and I've got some working knowledge of it now from being in Seattle, where we have coronavirus and having a practice that's pretty full. I mean, I think many of you know I just reopened my practice back here in Seattle in December, but it's pretty full already here. So I think for the average person with Lyme, I'm not seeing that they are any more susceptible to coronavirus than anyone else is. Okay, that's what I'm seeing here in my practice. I will also let you know that when we think about people with Lyme and we think about immune suppression, I know there's a general opinion that people with Lyme have immune suppression. And I think that's true. I think they do to a degree. But keep in mind that the immune suppression that most people with Lyme have is not an across-the-board immune suppression. It's a type of immune suppression where the germs hijack the immune system and send out chemical signals that suppress the immune system's ability to treat those germs. That doesn't mean across the board, though, okay? Now, there are some people with Lyme, I think, that will have a harder problem. And so what I've kind of been looking at, and what I know from previous virus infections like flu season, for instance, is that I do see that there are a group of people in my practice that whenever turns into virus season, they tend to get everything that comes along, and they tend to have a harder time recovering, okay? I would say that's maybe 10 to 15% of my practice population. And I'm saying practice population based on from when I was in practice, well before as well too, all right? So I think that the majority of people do not have an across-the-board immune suppression. I think that, and so what I'm advising my patients to do is, if they are a person that with their Lyme does not get the flu any easier than anyone else, does not get every virus infection that comes along, I think in general they probably are less susceptible to problems from it, okay? But if they happen to be a person that is more susceptible to picking up every virus that comes along, and they're the person that has a harder time recovering, I think they could be more susceptible, all right? So you have to look at what your history is and how you handle viruses. Also, what is interesting is there is some research that has come out now showing that people that are under treatment for their Lyme when they get COVID tend not to have as bad of a time as people that do not have that are not under treatment for Lyme. In other words, it seems to be that some of the things we're doing for Lyme treatment improve chances of outcome. And I don't know what that means yet. I think we're still trying to learn what that means, okay, or why that is so. All right. Thanks for that question, Brendan. Good luck. So Brenda, let me show you. I'm going to do a quick screen share here too. So I've addressed some of this in an article I've written about COVID-19 and Lyme. The last time I updated this article was back in early April. The recommendations still hold here. All right. So I talk about the severity of it and Lyme. There's a whole section here. All right. But if you're looking at things to do that might support your immune system so you have an easier time dealing with it, I have a whole section down here where I talk about how you support your innate immune system to help. I even talk about various supplements that might give a benefit, okay? And ways that the supplements you can even use that might help with virus replication, all right? Now, I hope you hear the word that I was using there quite a bit. I said might, because the issue is none of this research has been done on people with COVID-19. All right. So the ways that I am saying to support the immune system are just based upon broad support that helps with viruses. And the things that we can do to block virus replication, the majority of those have been done on research from a previous coronavirus, which was the SARS virus back in 2007. So for instance, research then showed that using the herb quercetin coupled with zinc could help block virus recommendations. And that's a recommendation I put into that piece there. But the truth is, we don't know if that's going to happen with this coronavirus, okay? So I write the article with things that you might think about doing, but I have to be clear, there's no evidence that these things actually do help in Lyme or with COVID-19 right now. Hello, DJ. Let's see. Would a 200 milligram of glutathione injection given IM be beneficial? Absent anywhere to get an IV. What about capsules? I know you only have Trifortify in your store. So in terms of Trifortify, it's a liposomal glutathione. That liposomal means it's microscopically wrapped in fat to increase absorption. Research Nutritionals, who makes the Trifortify, has done some studies showing that there actually is a good absorption of this, that you do raise levels of glutathione. They looked at red blood cell levels, and there's a marked improvement in those levels when you do the Trifortify. Now, if you're a person that does not like taking the Trifortify because of taste or because of the gooey nature of it, another option would be to look at a product by Pure Encapsulations. They have a capsule. They have a liposomal glutathione that is in a capsule form, and that might be another way to do it too. I don't carry that product at my store. The be careful if you try to search for that product. I think Pure Encapsulations also has a reduced glutathione product. Make sure you're getting their liposomal glutathione product if that's what you're going to do. Another way to do glutathione is to do it nebulized. You would have to have a compounding pharmacy mix it up for you. And you can do it, usually I have it mixed as a dose of 200 milligrams per milliliter. And you can do 2 milliliters of that twice a day. Sometimes that can give a burning sensation in your chest. And if that's so, then I have people add 1 to 2 milliliters of water to it before they nebulize. Okay, so nebulizer is a way of vaporizing your medicine so you breathe it in. Okay, all right. And then finally, you can do injectable. You can either do IV. IM is a possibility. I think 200 milligrams sounds like a reasonable dose to me, although when I'm doing nebulized, I try to do up to 400 milligrams, so you might even want to consider going higher. I haven't actually done it as IM injections with my patients because I'm either usually going to do the oral or nebulized. Rarely I will do it IV, but that does seem like a reasonable way to do it. All right. I'm going to show you an article that you can look at regarding glutathione and these recommended dosing regimens that I just talked about too. Let me do a quick screen share here. All right. So, article I wrote a while back called Glutathione, the Great Fixer. And in here, I talk about all the things that glutathione does. It's good for detoxification. It helps with Herxheimer reactions. It can help repair nerve and brain injury. It can liver injury, and you can use it you can raise it using supplements. You can do it by nebulizer, or you can do it as IV, and IM is an option that I did not write about here. I talk about how to do the nebulizer in this section here, okay? All right, DJ, thanks for that question. Good luck to you. Hello, Crystal. Let's see, Dr. Ross. Thank you for everything you do. I have been taking the oregano oil, 150 milligrams, 1 pill 2 times per day, along with Bactrim and Biaxin for Bartonella. The oregano oil seems to irritate my stomach and give me something like heartburn. I've also been told by my breath has a chemical smell. Is this a common effect of oregano oil? And can I do something to prevent the stomach irritation, or should I discontinue? So I would drop it down to 1 pill, which is 75 milligrams. I recently realized that I had intended of the product I carry, which is the doctor-inspired formulations, that people would do 1 pill twice a day because that's what I had been finding effective in my practice. And I misread the label. Their serving size is 150 milligrams, but that's 2 pills. And so I wrongly interpreted it as their capsule being a 150 milligram pill. It's actually, each pill is 75 milligrams. So I would decrease their, if you are doing more than 1 pill twice a day, I would suggest decreasing it down to the 1 pill twice a day. That may take care of it. The other thing is, if that still doesn't work for you, you might want to decrease it down to just 1 pill 1 time a day to see if it's more tolerable for you. Okay? All right. Good luck to you, Crystal. Hello, Patsy. Let's head. Hi, Dr. Ross. Thank you very much for hosting these webinars. I have 2 questions. Let's see. In the case of having Lyme and Bartonella, can you explain why you would treat Lyme? Oh, I already answered that one earlier. Got it. Hello, Tracy. Let's see here. Hi, Dr. Ross. I've heard you and other LMDs say that some vaccines seem to reactivate Lyme disease for people in remission. There are several different COVID-19 vaccines showing promise, and they have different structures and mechanisms. Is there a way to evaluate whether one vaccine might be better than another for Lyme patients? And a second question, if someone is following an herbal protocol that includes a number of cytokine inhibitors, could that affect the vaccine's ability to work? So first of all, regarding this vaccine and Lyme, I have no idea. For instance, we know when people get the flu vaccine, they tend to get reactivated Lyme. On the other hand, when they get a tetanus vaccine, I tend not to see Lyme get reactivated, okay? So it's all going to depend. I don't know for COVID-19 vaccine as a whole, any of them, will it reactivate Lyme? And in addition, will one type of vaccine have a greater chance of doing it than another? I don't know. We actually really don't understand the whole mechanism of why the flu vaccine tends to get Lyme active or not, okay? So the big answer there is, I don't know. It's a valid concern, but I don't know. Let's see. And will the cytokine inhibitors prevent the vaccine's ability to work? It's hard to say. I need to see what the final mechanisms are that the vaccine works by. And at this point, I actually have not been following the literature to know about the 3 promising candidates yet enough to know what is the mechanism by which they're working. So I'd have to take a look at that and see it. I don't know that answer right now. All right. Good question. But keep in mind, Tracy, we are a long way away. We're probably at least January or longer before we're going to have a true vaccine that people can get. So hopefully I can have some of those answers for you by that time. Okay. All right. Thanks for that question. All right, everyone. I think I told you earlier tonight that I had to do a shortened webinar tonight. I've got another obligation that I got to get to this evening. I'm glad to have had an hour with you, though. Keep an eye out in your email tomorrow morning. My intention is to get that to you early in the morning. And with that email, then you can go ahead and get the links to see the recorded webinar. The other thing that you'll be able to do with that email tomorrow morning is I will have the sign up links for the next series of webinars that will begin a week after next. Okay, so next week I am off. And then at least from doing webinars, I'm off. I'm still working, but I'm just not doing the webinars. And then the week after that, I will begin again. Okay. All right. Good night, everyone. Thanks for showing up here. I'm sorry again to have to do a shortened webinar, but I'm glad we were able to get some of it in this evening. And take care. Be safe out there. Good night.